Thank you, Mr. Chairman, and thank you for holding this very important hearing. We appreciate all of you all. We enjoy working with you very, very closely and appreciate all you represent. It's clear that we are experiencing significant challenges regarding staffing, and that's true. I think every community I'm in, whether it's the biggest community in Arkansas or the smallest, that's a real problem throughout society in general right now with the labor force. But I know it's particularly hard with, people that you're looking for regarding health professionals and all that you're searching for. I was very concerned. I know it's been discussed about the possibility of deploying personnel to the border. We introduced legislation to prevent that from happening. So not going to go into detail about that. Like I said, I think it's been discussed, but I would be very much opposed to that. And I think as talking to my colleagues that there's a number that would also be in that camp. So it's imperative that we hire and retain the best and brightest talent that this country has, because our veterans and their family deserve the highest levels of care and support for the sacrifices they've made in protecting our country. And I know you're working very, very hard to do that in a difficult time. Mrs. Grosso, if you had to rate on a scale from 1 to 10, how would you currently rate the severity of staffing shortages facing the VHA?
Sir, I really can't speak to the shortages at VHA. I will let Ms. Bongiorni characterize that.
Well, we'll let her do that then.
Well, having not given a rating previous to the pandemic, I'm going to say I would rate it at a 7 right now. So
what would you say before the pandemic?
Probably closer to a 4 or a 5. We have areas where we had isolated concerns, but now we're seeing concerns across the country.
Okay. Very good. What are the areas where you have the high shortages?
Our biggest concerns right now are at the higher end of the pay scale and the lower end. So our entry-level occupations are really where we're having some difficulty, in addition to nurses, as was previously mentioned, but we're seeing the most labor pressure for positions like housekeeping aides, health technicians, food service workers, where we're competing directly with private sector, offering higher hourly wages.
I know you're working really hard to prevent it from happening, but is it affecting your ability to deliver care?
I do not think it's affecting our ability to deliver care at this point. We still have some flexibility to do some contracted staff if needed, but we are seeing continued sustained higher turnover and less success rates in each of our hiring attempts.
So hiring is difficult and retention is difficult.
Yes.
Also right now.
Yes.
Why do employees stay at the VHA?
I think they like the work environment. We continue to be rated as a very solid employer and score well in best places to work. When we look at our exit survey data, about 3/4 of employees would still recommend VA as a place to work, and they would plan to come back. We do see, however, that only about 1/4 of supervisors right now are asking their employees to stay. So that's what the employees report. So right now we're working on an initiative called Stay in VA, where we work with managers to have them not wait until someone's going to leave to ask them what would keep them there, but to talk to them throughout their employment, to encourage them to stay and build a job that they want to stay in for the long term.
My next question was that it's estimated that roughly 3 million rural veterans are enrolled in the VHA. More than half of these veterans are over the age of 65. These members often have more complex medical conditions requiring specialty care. What initiatives and strategies are being discussed to improve recruitment and retention to ensure proper staffing in those areas? I know it's difficult in the private sector also.
I think so. We are looking, especially for specialty care providers, we have challenges on the higher end of the pay scale, where it's very difficult for us to compete with specialty providers. There's also a national shortage of occupations, people who are geriatricians, for example, which is an occupation that's very important for us to fill. So we need to continue to offer scholarships and encourage people to go into those fields through our training programs.
So, and the importance of the partnerships with our medical schools and those kind of things, we're doing all we can to strengthen those.
Yes, we are affiliated,
Dr.
I think,
Clancy.
with 99% of the nation's medical schools. So as new medical schools come online and all of the osteopathic schools as well, this has been a 75-plus year
Right.
partnership. So after Medicare, we have the biggest impact on the future healthcare workforce. And it's something we relish and are very thrilled about.
Good. Thank you. Thank you all very much. Appreciate it.
Senator